Are you thinking about stopping Mounjaro and wondering what that process actually looks like? You're in the right place. Today we're covering what happens when you stop taking Mounjaro, what to expect, and most importantly, why this should always be done with your doctor's guidance. Mounjaro, also known as tirzepatide, is a once-weekly injection licensed in the UK for managing type 2 diabetes. It works on two hormone receptors, GIP and GLP-1, to help regulate blood sugar levels. It's effective for many people, but there are plenty of valid reasons why stopping might be the right decision for you. Those reasons could be medical, persistent side effects like nausea, vomiting, or gastrointestinal problems can significantly affect quality of life. If you develop a severe allergic reaction or acute pancreatitis during treatment, your clinician will advise stopping straight away. If you're diagnosed with medullary thyroid carcinoma or MEN2, multiple endocrine neoplasia syndrome type 2, seek urgent specialist review and your clinician will advise on next steps. Practical reasons matter too. Cost, difficulties with the injection routine, or reaching your treatment goals might all factor into the conversation. And if you're planning a pregnancy, the MHRA advises stopping Mounjaro at least 1 month beforehand, as its safety in pregnancy hasn't been established. Now, here's something that surprises a lot of people. Unlike some medications, Mounjaro doesn't typically need to be gradually tapered. There's no official dose reduction protocol. Your clinician will usually advise stopping at your next scheduled dose, but please don't make that decision alone. Medical supervision is essential. Here's why. Tirzepatide clears from your body naturally over several weeks after your final dose. But during that time, your blood sugar levels can shift. If you're taking other diabetes medications alongside Mounjaro, such as insulin or sulfonylureas, your doctor may need to adjust those to prevent either hyperglycemia, that's high blood sugar, or hypoglycemia, which is low blood sugar. Any changes to those medications must be directed by your clinician. Your GP or diabetes specialist will create a personalized plan to manage that transition safely. So, what should you actually expect after stopping? One of the first things many people notice is a return of appetite. The hunger suppressing effect of Mounjaro diminishes gradually, and increased hunger is often the earliest change you'll feel. Alongside that, it's common for blood glucose levels to rise and for some weight to return. This doesn't mean the treatment failed, it's simply how the body responds when the medication is no longer present. Your healthcare team will likely recommend enhanced lifestyle modifications, including diet and physical activity, and they'll want to monitor you closely during this period. Before stopping, make sure you discuss a monitoring plan with your doctor, including how your blood sugar will be tracked in the weeks that follow. Talk through whether your current diabetes medications need reviewing and book a follow-up appointment. A review around 4 to 8 weeks after stopping allows your doctor to assess how your body is responding and make any necessary adjustments to your care plan. If at any point after stopping you experience symptoms of very high blood sugar, such as excessive thirst, frequent urination or fatigue, or symptoms of low blood sugar, including shakiness, sweating, or confusion, contact your GP or diabetes team promptly. For severe symptoms, seek urgent medical attention or contact NHS 111. So to recap, Mounjaro doesn't usually require dose tapering, but stopping it always requires medical supervision. After discontinuation, blood sugar changes and increased appetite are common, so monitoring and lifestyle support are key. Any adjustments to insulin or other medications must be clinician directed, and if you're planning a pregnancy, speak to your doctor well in advance. Nothing in this video is a substitute for personal medical advice. Always speak to your GP or diabetes specialist before making any changes to your treatment. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more straightforward health information. And if you have questions, drop them in the comments below.